Good evening, loved ones. I'm home, I'm alive, and I am doing pretty well considering what was done to me on Friday. So today is day 5, I believe. And I'm finally eating 6 portions of half cup of mushy, liquidy baby food and drinking about 1.5 liters of fluid per day. And I was able to walk about 1 kilometer today outside. So, all in all, my recovery is going, pardon me, pretty well. What do I want to talk about today? Well, I had Roux-en-Y bypass bariatric surgery on Friday last, and they also removed my gallbladder, which is called a colacystectomy, at the same time. Let's talk about what that process was like, because I've been really honest all the way through this, so I want to share it because honestly, before I forget it, because usually traumatic experiences you forget, and also I've never seen somebody be super honest about this. So that morning, because it's COVID also, there's a whole bunch of other stuff that had to go into it. We went in. Annie, my wife, took me in. And we both had to be wearing masks, obviously. It was still dark outside. My arrival time was 6 a.m. And 2 security guards stopped us on the way trying to be like, hey, where are you going, blah, blah. So I said, I'm having surgery. And they finally let us go upstairs. Once you get upstairs, they put you in this little room. Pardon me, I'm still kind of throaty because when you go under anesthetic, they put a tube down your throat for you to breathe. I don't know if everybody knew that or not, but that is a thing they do. You're not aware of it because they put it in and take it out while you're sleeping. So yeah, we went up to the 10th floor where they left us all in this kind of bullpen thing together, waiting anxiously while they opened up because we were the first patients of the day. And they called me by name, and I filled out some paperwork. I spoke to the nurse. She gave me a gown. I had to go behind this little thing and change into it. Take off everything and change into the gown. I had some more blood tests so they could cross-type and match my blood, meaning that they were preparing to give me blood in case I lost blood during the surgery, which didn't happen as far as I know. So that was a good thing. An orderly came for me with a stretcher. I think they put you on a stretcher so you can't run away, honestly, because that was the hardest part. When Annie kissed me goodbye on the stretcher and he started to wheel me away, I started to change my mind. I was like, maybe I could just get off the stretcher. Maybe I could just go home. But I talked myself into it because I knew that it was a necessary thing to do. Then they put you in this little hallway and they make you wait. It's pretty cold there. I'm told there's a medical reason for it. I'm not sure what it is. And a nurse comes to see you and double checks your identity. A doctor comes to see you and double checks your identity. Then an anesthesiologist comes to see you and pokes you with a big needle to put the catheter into your vein and asks you a bunch of questions. And then your surgeon comes to see you and set your expectations. For me, the expectation was that even 3 weeks of starvation may not have shrunken my massive fat enough for him to reach my intestines, so there was a small chance he couldn't do the bypass surgery that I wanted. And he would have done a sleeve gastrectomy, which is completely valid choice, but just I felt not the right choice for me. Luckily, that's not what ended up happening, so that's good. Spoiler. Okay, so after that, I had the privilege, because I have a back injury and I told them about it, I had the privilege of not being drugged before walking into the OR and going in completely conscious. I walked in on my own 2 feet. They placed me on the table. It was freezing. I was shivering. It was so cold. But there was a really nice orderly in there who put heated blankets on me and then placed my feet and arms in positions and asked if I were comfortable because of my back. So they let me be conscious for that part, just to make sure that they didn't throw my disc out. And after that, they put these kind of squeezy things on your legs to make sure that you don't get clots while you're under anesthetic. And he made sure that I was comfortable and strapped in, because from what I was told, they sort of sit you up. The table goes up and you're kind of in a standing position when they're doing the surgery, or at some part during the surgery. So I said I was comfortable. And then the anesthesiologist said, okay, are you ready? And she put some stuff in my IV, and the whole entire room started to spin, and I was asleep. Like, I instantly had no idea what was happening. Something weird happened during my surgery, which I'm not going to share publicly here, not because I'm ashamed. You know that I share everything. Just, I don't want to scare people who may be starting to go through it. Because it's not typical, but it was something specifically to me that happened. If you're interested to know what it is, you can always message me and ask. But I'm not going to publicly say what it was because I don't want to terrify people. After that, I woke up in the recovery room, and I had about 10 people around me. They were very attentive. They asked if I was nauseous. They asked if I was pain. They put things in my IV. They told me that they had my apnea machine, but I didn't need it because I wasn't desaturating. So I just had the oxygen thingies up in here. And I think they put me on a bedpan. I don't remember. I think they did. And then they sent me up to a room where I slept, I think. I don't remember a lot. That first day I was unconscious for a lot of it. I remember meeting my nurse later, who was really nice, and she tried again to get me to pee, and I couldn't pee, which was scary for me, but apparently it's something that happens when you have anesthetic. Sorry, that was a burp. That's also a thing that happens a lot after you have bariatric surgery, because they pump you full of air. Your whole entire system is pumped full of air during the surgery, and you have to actually burp and fart to get it out of you because it hurts and it's very uncomfortable and it makes it difficult to eat, which you have to do or you won't heal. What else? So yeah, I met the nurse, and she was great, and she helped me try to pee, and she helped me with a bunch of other stuff, trying to get up and walk around a little bit so I could take the things off my legs, and not be a risk of blood clots, for example. She gave me meds. I remember they gave me some water to sip on, and then she left, and a tray with liquid stuff came on it. It had like juice and broth and different things. The last thing I wanted to do was eat or drink, but I knew that I had to if I wanted to go home. At that point, I hit the call bell because I had intense pain in my abdomen from being manipulated. I have 5 holes in my abdomen now that are healing, and I couldn't really get up on my own or do anything. So I hit the call bell, and this orderly came in, and this was the first day after surgery, mind you. I still had anesthetic in me. I was still half asleep. I was in intense pain. And she says, oh, well, there are buttons on your bed. You can work them yourself. Be independent. And when I was like, excuse me, she was like, what? I'm just telling you. And then she left the room. So, orderly lady who works on the 10th floor post-op for cardiothoracic surgery, who is blonde, wears too much makeup, and has a big butt. I am calling you out in front of everybody. You are a horrible, horrible PAB, and you should not be doing that job. There was absolutely zero help from her. Again, that night I called the call bell because I wasn't paying for meds. And when I told her I had been ringing for an hour, she said, "So what? What do you want me to do for you?" But thank goodness she got my nurse, and I complained to her, and she gave me the meds, and everything else went smoothly from there. So having said all that, obviously I wasn't going to recover there, so I did everything I could to get out of there. I followed their medical pathway. I walked the halls. I obviously used hand sanitizer every time I did that, and had my mouth covered. I drank the water. I took the meds. I ate the things. I did all the stuff that they asked me to do, even though I felt like hell. But that was okay. And the next day, the surgeon came and told me everything had gone really well. I have no more gallbladder. I have a Roux-en-Y bypass, which is the surgery I had wanted, which means they make your stomach very small to the size of an egg, and then they bypass part of your intestines so you don't actually absorb all the food that you eat. What does that mean? That means I'm going to have rapid and effective weight loss, but it also means that I have to take multiple vitamins and supplements for the rest of my life. It also means I'll have to be eating every 3 hours for the rest of my life. And I can never drink and eat at the same time again. So I have to stop drinking for 15 minutes before I eat, and I can only start drinking again 30 minutes after I'm finished eating. Yeah. Once I got home and I slept in my own bed, I felt a lot better the next day, but it was still rough. I'm telling you, for anybody who's thinking that weight loss surgery is the easy way out, it is not. This has probably replaced having the children without anesthetic as the hardest thing I've ever done in my life, because combined between the pre-op diet and the post-op pain and recovery that I had to go through, recovery has been difficult. But today is the first day where I feel really, really good, and I'm starting to feel a little bit back to myself. So I have another week and a half of liquid baby food diet, and we'll see how that goes. Since I got home on Saturday, I've lost 8 pounds. It's now Wednesday. And we'll see how that goes, and I'll keep you all updated. Thank you, loved ones. Nice to see you again.